My name is Kafunya Mulyasanga. I'm coming from Zambia. I was diagnosed with oesophageal cancer in my country in the mid-year of 2022. When I went to our general hospital, they recommended Max.
When he came to us, he was completely dysphagic, was hardly able to swallow liquid diet. And when we evaluated him, we found that he was suffering from a middle esophageal cancer, squamous cell carcinoma, and it was in a locally advanced stage. After having a detailed assessment, we decided that he should undergo chemotherapy and radiation, and followed by a reassessment for his response. And if he has a good positive response, and then we will take him up for a surgery.
So I started with chemotherapy and radiation. They went simultaneously at the same time. 5 days I did radiation, and on the 5th day I did chemo.
And pleasantly, he had a very good response. Later on, we subjected him to surgery. So he underwent something called as a minimally invasive oesophagectomy, in which we removed the entire esophagus and part of his stomach and reconstructed his esophagus using the part of his remaining stomach. Now, this entire complex procedure was done laparoscopically and thoracoscopically. Patient had a miraculous recovery. He was in hospital for about 7 days, and when we discharged him, he was eating everything by mouth. He was fully physically active.
Whenever I took food, solid foods, or even liquids, I used to experience extreme pain behind my back, and I was surviving on painkillers. Now, as I speak, no feeling of that. I can take food without any pain.
Today, we treat esophageal cancer with multimodality therapy. We start treatment with chemotherapy, radiation, we shrink the tumor, and then we operate. Now, the minimal invasive surgical techniques have brought revolution in the treatment of esophageal cancers. Most of these surgeries are now done either laparoscopically and more recently robotically.
I want to thank you very much because of the services that I've received from Max Hospital.
So I wish Mr. Mulyasanga a very healthy and prosperous life. He is cancer-free as of today, and I pray to God he remains so in coming years. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.